Do you want me to use the speakers?
What's that?
Can you hear me with this, or do you need me to use the earphones?
Yeah, I hear you. Great.
Let's see.
You ready?
Ah, how was your day?
You ready?
Recording.
So, Dr. Jeanette, thank you so much for coming on my show. I really appreciate it.
I'm really glad to be on your show, Dr. Paul, because I think your topic is really timely these days, and so much is going on. People are just looking for questions.
Well, I brought you on because to let the audience know that you had me on your podcast.
Yes. Yeah.
And I've done since my book came out, I've done oh geez, at least a dozen podcasts. Uh,
Yeah.
but your interview really stood out. And like you said, I like the way you said it. It's not so much an interview; it's more of a conversation.
Right.
And but yeah, it really stood in my mind, and that's why I got back a hold of you, and thankfully you answered and asked you if you could be on the show. So if you could share with the audience your background, what you do, if you could share about yourself.
Sure. I've been in healthcare probably for 55 years now. In some manner to speak, I've been a dental hygienist, a surgery assistant, insurance representative, a naturopathic physician. And now I just really work with a lot of end of life patients, and they're reviewing their life and they're saying, what was it all about? Did I really waste it? And they're afraid to die. And I think if you drum it down, both your topic and my topic, it's really about fear, shame, guilt, and safety. And if we look at those four things, isn't that all we're doing? We're just kind of like using our decades for all this stuff, right?
Right. Talk about more about that because you're so right about fear and shame. I think as far as what I've seen, I think statistically, the number one fear is the fear of dying.
Mhm.
And I know there's flying's up there, public speaking
Right.
is up there, but the fear of dying, and we all do.
Uh-huh.
Like I say, none of us makes it out of here alive. But yeah, but that's a very common one I hear. Now, your background is it your doctorate? Is it a PhD or
We are medical doctors considered in several states in the country,
huh?
over almost, I think it's 22 states now. So we're considered primary care physicians with a natural medicine focus.
Okay. Is it like how do you say NP or
Naturopathic physician.
great? Now, share us with what that means. What is the naturopathic physician as compared to the traditional medical approach?
I think the first thing that you really be shocked at is that when you have your first visit, it's 2.5 hours, sometimes 3.5 hours. You're sitting down and you're just saying, I don't know where I am. And we start there and then we work backwards. And then it's like, okay, I don't really have any answers today, but let's try one thing going forward. And rarely is it a drug or a testing. Usually it's just sit down and journal for me, answer some questions, tell me what's going on. Perhaps go home and say, you know what, I forgot to tell you this, and I'll tell you next time. So it's really about helping the person open up to explore. I think, Dr. Paul, it's really important you said about the fear of death. I think the biggest fear people have is validation. They want to be seen in the world, and they want to make sure that they're seen correctly, healthy, wealthy, and wise. Isn't that what everybody's looking for?
Now, do you work with being a naturopath? Do you work do you do what kind of testing do you do? Do you do blood tests? Do you do urine, saliva? What's the kind of testing that you do if you do testing?
Right. I have availability to do any testing that I want to have done. It could be anything from a blood test to an MRI to a CT, it doesn't matter. However, I truly don't use testing anymore. What I have found is that people have the answers in them, and 99% of the time, it's not fix me. Sometimes it's help me, support me, or stand next to me. It's not fix me with another drug or another test.
Is it more like almost like being a therapist and counseling them and
Yeah.
listening to them and giving them advice?
Right. It's similar to that, but it's also too, when you have a therapist, you're watching their body language. Are they listening to me? Can they hear me? And since I'm a medium also, and I've been like this my entire life, I can tune into somebody's, okay, but I don't really think that's what you're talking about. Maybe you're talking about control. So what's control all about, Or maybe, I see you're freezing all the time and you really want to look at your thyroid, but you know what? Have you ever thought about your past life? Or maybe, where are you hiding from? So I think where I come in is I'm more of that person that sits next to you instead of up on a stage or over across the room or behind a computer. I'm sitting next to you and tell me what you're hiding, because that's usually where you start.
You work it all with herb supplements, anything like
Everything.
you?
Yep. Herbs, supplements, homeopathy. I could do acupuncture, acupressure. We do chiropractic adjustments. We have the gamut that we're able to use.
Do you do acupuncture too?
Hmm.
Wow. Do you
Yeah.
do hypnotherapy at all?
Yes. And Chinese medicine and everything. Hmm.
Wow. So now,
Chinese medicine's the best for people with mental health.
do you do like with under therapy or under hypnosis, like past life? Do
Past
the
life regression.
wow.
Yeah. Yeah, I could tell someone's past life, they just open their mouth, so I don't need to worry so much. I think sometimes people feel like they're going to be scared or someone's going to find something out about them. So I'll say, just keep talking. I had someone the other day, we were on the show, and I said, "Oh, I see you in a bed of flowers." And she said, "Isn't that interesting? I'm sitting on a futon, which is a bed, with a blanket with flowers on." I said, "Oh, I guess we're right then, aren't we?" And that opened her door so she could go forward. You have to have these little doors to open up people's heart and mind, don't you think?
Yeah, that's fascinating. I think when you had me on, I said, you had me on to talk about my book,
Yeah.
and I mean, going back with my background, going into medicine and getting my MD degree, I didn't really know what I wanted to do, so I liked different aspects. So I chose family medicine because I just liked the primary care approach, really getting to know my patients and then, and I would do, everything a primary care doctor would do. But it's not, but I got really interested in neurochemistry. Back when I started practice in like 1992, at the time we had SSRIs around,
Right.
medications I talk about on the show. I talk a lot about medications, but they work on serotonin. But when Effexor came out in 1993, a year after I started practice, I started to see some really interesting things happen, and people would come back to me and say, you know what? My neck pain is better, my back pain is better, my fibromyalgia is better, my irritable bowel syndrome is better. And they started to see, and I started to realize, and I talked about this with my when I went through training with my attending physicians that one of the attending doctors said to me, Paul, you're going to notice in your practice that pretty much most people who come to the office are under stress.
Yes.
And so I started to really focus. I started to really pay attention. You're right. They come in with high blood pressure. They come in, they're stressed out. They want a tranquilizer. It's like well, let's get deeper. What's causing the stress and why are you going to stress? So I started to see that. But at the time when I was in training, all we had was SSRIs. So the problem was you would give something like that, and then they kind of feel flat. They might feel apathetic. I figured out they're okay with some people. They're not the best medications out
Hmm.
there. And then when the SNRI came out, Effexor is when I really started to see people coming in and saying, like, what the hell did you give me? And
Right.
I started to see people like physically getting better. And I started to see this connection. I thought it's got to be norepinephrine. I mean, that's
Yes.
that's got to be the piece that's doing this. And so, and then I started understanding augmentation, and when I add Wellbutrin, I would boost dopamine, and then their energy and motivation would get better. And I probably is controversial if I say holistic. What I do, I call it holistic because I think holistic means helping the body heal itself.
Yes.
And with psychotropic medications, which may not, be some physician doctors may not feel comfortable with these the way I look at them is they're balancing the person's natural neurochemistry. And so what I've seen for such consistency over the years is how people just they get back to themselves again, with just doing one or two simple things. And all these medications are doing is balancing neurochemicals that were previously out of balance, or else they wouldn't be doing anything. And then I started understanding in the 90s, and I got so into it that it became so much more interesting than primary care to me. That then I started really understanding bipolar disorder and all these other things, ADD, and all these other things I was really understanding. And then about 10 years after my practice started, about in the early 2000s, is when I started to say I have to give up primary care. I'm getting way too busy. uh,
Yeah.
I'm so fascinated by what I'm seeing, and I'm seeing in such a different people's lives that I can't just keep doing that anymore. I have to pursue this, and that's when I started writing my books. And I know we talk about my books on your show,
Mhm.
but then I started writing because I really started to see, why aren't I started understanding doctors aren't picking up on this.
Right.
Doctors are basically treating symptoms. You have some pain, here's a pain pill. You've got, oh, here's some an indigestion pill, or here's a this pill. And even high blood pressure pills, sometimes the blood pressure is high because of stress, and they don't need a high
Right.
blood pressure pill. They need to get rid of their stress.
Yeah.
Now would all of a sudden get rid of their stress, and they go off their high blood pressure pill. And I started to see, like, man, this stress thing is really big. It's there's a lot of
Yeah.
anxiety out there. We live in a stressful world. We have there's a lot to be stressed about. And then when I started seeing this mind body, I call this mind body connection, where the mind and body were connecting, and that it was so fascinating to me, which is why I the first three books were called Healing the Mind and Body. It
Right.
took me 12 years to complete them, but I started writing because I realized that other doctors aren't picking up on this. I need to do something about this. I need to educate, and that's what led me on the writing blitz, and I
Yes.
haven't stopped since then. So
Well, Dr. Paul, though, it's really important to notice you have taken the biochemical and the physical part. However, I've been, I've, with the degrees, with all the classes I've taken, I had a spectacular quantum physics teacher.
mm,
Okay. And if we think about the body as an energy body and an energy being, what is a drug but something that you know from your organic chemistry class? How many polars, left or right, or is it going this way? How many carbons or oxygen, whatever it is. And you know how they always get the generic drugs, they tweak a little bit, things like that. So we know that it's really about energy. It's really about polarization. So if we think about polarization of our body, you're affecting it with the medications. Now, with myself, I do it with herbs and things like that. But I also, by talking to them, if you've ever talked to somebody who's had a whole life of abuse or really big things going on in their life, they'll come and say, I'm so stressed, I can't get myself out of my own way. I'll say, who was the monkey on your back? And if you can identify who it is or what it is, that's not the stressor. That's just the effect of the stress on the energetic body. So then you start there. So truly, it's a combination. I mean, really, medications, supplements, herbs, diet. We all know about the gut and the brain connection. That's a really big paddy wagon everybody's on right now. Change your dopamine, change your serotonin by taking a probiotic. And I think people say, but I want to know who is the expert who can fix me and make me better as this. And that's where the problem in there lies. Are you asking someone to make you something that you believe you need to be, or you ask someone to help you in your quality of life? That's two different things. And if it's someone for quality of life, you could still be living in chronic pain all the time. It might just be that your physical structure is laid out that way, but what happens is you help them see it differently. So when mental health things come in, they start seeing it differently. It just seems to disappear. I shared with you before about this. I get migraines. I mean, like I always say, the dump truck is rolling over my head. It's backing up. It's going forward. It's backing up. It's going forward. It's been like this my entire life. And it comes in spurts every 5, 6 years. We'll have a real, blowout for maybe 2 or 3 years where get away from me. I don't want to talk to you. And I'll have really good years. And I always likened it to my spiritual growth, changes in my practice, changes in my relationship. Every time it was almost like being pushed against that wall and saying, whoa, what are you feeling? Where is it coming from? And then we'll work on it. And my neurologist had said to me, oh no, we're just going to give you some migraine medication. You'll be good to go. And I said to him one time, I said, really? And I reported some of my side effects. And he said, well, I've never heard that one before. I said, obviously you don't treat zebras. And you and I know this conversation all the time with physicians. Everybody is a horse. My daughter is an ER physician. Everybody is a horse. You got a cold, sniffles, you got a cold. You got a pain, you got this. You got a headache, you got that, right? And I said, no, I'm a zebra. I'm here to teach you. Are you ready to learn? And he could not get it. So I had to let him go. However, I think that's where your practice comes in is you treat zebras. I treat zebras and I welcome them. I mean, like, and I have a sign that says, welcome to the zebra pack, Yeah.
I love working with zebras, you know.
Yeah. But they're the ones who really are truly open to something, a different conversation. In other words, they're spilling their heart to you. The ones that just want to be a horse, they're only looking for a fix it. So yeah.
Now, with the supplements, are you working like the supplements that like boost serotonin, boost dopamine, or that what are tell me about what those do and the probiotics, which are also really interesting to me.
There's a lot of different probiotics that are coming out in the market now, but I get to honestly tell you, I do nothing or refer anything to anybody unless I try it. And 99% of them that are out there right now, I throw them in the toilet because people that have chronic situations are putting in a melting pot and you're putting this probiotic in there and it is turning it to a swamp. It's getting really funky. So it really doesn't work. I mean, if you're getting someone who's new to the game, all of a sudden something just came up, you want to fix it, good to go, that's okay. But these things are really turning out really ugly. And I have not found any probiotics at all that work. Only one, Atron. It works on SIBO, small intestine. That works every single night. You will sleep. Whatever is bugging you will quiet down. So I call it the conversation probiotic. Whatever's going on in your head, it's going to quiet down. Other than that, there's nothing that I use. There are new ones out there now for dopamine, serotonin. There are new ones out there that will, work with the GLP-1 and this, that, and the other. And I'm like, nope, don't want them. Don't want them. But if you start to clean things out, you'll notice things don't bother them so much. So even that, being a medium, I work a lot with ghosts too, past lives, things like that. I mean, the other night, my husband had said to me, he says, I walked out in the kitchen and everything on the counter fell on the floor. I'm going, oh, okay. He said, yeah. And then I sat down and the bathroom door kept opening. And I'm going, oh, okay. Energy in this space is imbalanced. So let's balance it. So we clean out the space, open the windows, do some sage. Same thing with your body. Whatever your thoughts are, whatever's holding on to you, what's got a grip on you, start to find out what that is and say, oh, yeah, what I mean? With a 3-hour appointment, you could talk about your husband till the cows come home. I don't care. But you're going to come to a line that says, I've been done with him since the day I met him. I just felt like I was this other thing. I even had another patient and I asked her, I said, what is your middle name? Don't know why I asked her. She said, Joan, like Joan of Arc. I said, why are you being the victim your whole life? And she carried the victim card till the day she died. But she took it on. And I think just yours is a very much helping that soup start to clear up by giving it some more energy force. I take the other stuff away and then the people will start to rise up. It is a long process sometimes, but sometimes you could do it 2 visits. Never know.
I've always been fascinated by acupuncture. Can you, I mean, the Chinese medicine has been
Yeah.
around way longer than Western medicine. And is it the chi in the child? Is it balancing? I mean, I've always thought. I'm wondering if it's doing with what psychotropics are doing with balancing neurochemistry, or what is it exactly doing? And I know it works. I've had patients tell me that it works, but what is it exactly doing?
Well, if your body is an energetic being already, it's just lining up the electrons and get in line. That's all. It's taking the outliers out here and bring them into focus. Same thing with your psychotropics. What do you think you do with something for your mental health? You think it is working on your nerves and your brain. Hey, honey, it's also working on your toe. It's also working on that spasm in your back. It's also working on the hair on your head. So if we think that we are just all of these channels, like in the 90s was the biggest boom. And there were specialists up the wazoo, everybody wanted to be a specialist. Well, now we have specialized our body out. We can't even find it. So what it's doing is it bringing it back into focus.
Hmm.
And that's what you do, with the psychotropics, it brings everything back in collective. Same thing with acupuncture. I could put a needle right here in my hand and my headache will ease. However, if I've got a pain in my back because my C2 and 3 are out, I could do this till the cows come home. It's not going to do squat, you know? I need to be able to lay on a table, have someone lift my occiput off my head, and just sit there and breathe. And that's more of a point. So I think the idea is, how do you finesse the way to help the person in the best way? Because even with the psychotropic, if you sat someone down in your chair, you said, we have a massage therapist today, we're just going to massage your feet. Guess what? They're not even going to be able to think to tell you what's wrong with them because they've already opened themselves up. All of the acupuncture points are in your feet. It's like, oh, okay, cool, you know? So it's a different way.
Right, because it's like don't you like the whole body? Because I never understand that. Okay, you put a needle here and this gets better over time.
Yes.
It's like a totally different part of the body.
Yeah.
Is that, how is that working?
It's very similar to your dermatomes, on your body. You think about them in the same areas. Also, too, you think about, well, I'm going to affect, I love this one. They will say, you have a problem with your blood vessels. So go to a cardiologist, but I have a problem with a blood vessel in my toe. Go to a foot doctor. I got a blood vessel in my head. Go to a neurologist. Maybe it's over here in my arm. We're going to go to somebody else, you see? So it really dissects it, where acupuncture just says, I mean, I can put a needle on someone not knowing what the needle point is or anything, just touch them and they will just feel the need to open. So I think that sometimes the touch, sometimes the opening of the energy channel, and sometimes someone saying you're going to be okay, safety and security again, going back to the beginning, is really, it does help a lot in Chinese medicine.
Yeah, I think it's, listening to our patients is so important,
Yeah,
and just having empathy and just listening, because I think most doctors are really good at talking and really not very good at listening. Or
yeah,
if I'm the doctor, like you're the patient, you do what I say, be quiet, don't give me your opinion. There's so much of that. And I have to say, in Western medicine, there's a lot of it that happens.
yeah,
I think with my practice, I've always learned to let the patient talk. If you let the patient talk long enough, they'll tell you what's wrong with them.
right,
Um,
right,
but yeah, what I started finding, and again, the way psychotropics work, just for the audience, I'm not sure if I really talk about the details, is there's over 100 billion neurons in the human body in the nervous system, um, and there's over 100 trillion connections between the cells, we call the synapses.
right,
And the chemicals are traveling from cell to cell around the body about 1,000 times a second. Each neuron connects to between 1,000 and 10,000 other cells. So it's pretty mind blowing, the numbers there, but basically, and where does your nervous system go? Everywhere. Your fingers, your toes, like you said, your hair, your chest, your
right,
gut. So that's why what I started seeing, which was fascinating me, is I would give a psychotropic, especially beyond an SSRI, especially, and all of a sudden the irritable bowel syndrome is better, and then the high fibromyalgia is better, and the neck and shoulder, and I was like, what's going on here? And it made sense to me. I was like, well, because the person's nervous system is balanced, and since the nervous system is going everywhere in the body, no wonder, because people that say, I don't understand how can it affect this and this at the same time, and I said because your nervous system constantly going around your body, and when it starts balancing, and so all the psychotropics doing are fixing leaks, and so when chemicals are leaking the wrong direction, it
right,
throws the body off. And when they basically attach to the cell membrane at the neuron level, and they just basically stop the leak, force the chemical the correct direction, and that just is what causes that balance. And it's been fascinating to me ever since. I mean, 30 years later in my practice, that I'm still fascinated every day by what I see, and the satisfaction I get from my seeing patients get better. It's fun. I think I love what I do because it's fun. It's like figuring out a puzzle. When someone
yeah.
comes in and they have all these a myriad of things wrong with them, and you're trying
Mhm.
what to
Well,
do.
what, Dr. Paul, I think it's interesting too that you say that because so many people are jumping on the leaky gut bandwagon, but also too, there's leaky blood vessels, there's phlebitis. You think about anything in your headache, it could be inflammation just anywhere. And then they go on, oh, well, it's inflammation. Let's squash that down. And it's sort of like, I always liken it to, we stepped into this big, if you think back at embryology, really, our bodies are just a donut hole, a great big donut. And all of these things are inside that donut, and they're just kind of folded up different ways, and they're all inside of there. how would you think that they would not affect each other?
Right.
It almost doesn't make sense. It's just that medicine has quantified and qualified it so that they could have power over that society or power over that dogma. And in essence, that's what Chinese medicine does not do. It just says, oh, we see all of this. Did you stub your toe at the grocery store? Maybe you shouldn't have bought the bok choy. You know what I mean? So it's sort of like to just be happy about it. It's sort of like because when you went to stub your toe, you were irritated. And bok choy doesn't help with irritation. You know what I mean? So if you can make it light and simple in life, I think that takes a lot of weight off of people.
Yeah, and you're right. I think in medicine, Western medicine, there's so much specialization that oh, you got some problem here, see a neurologist, see
Yes.
a GI doctor, see a this, see a that.
Yeah.
I saw so much. I mean, this is what I saw that even in medical school when I was, when you trying to figure out what you want to specialize in. And I just thought, I don't want to specialize in any one thing. I want to just do more variety. That's why I chose family
Right.
medicine to begin with. I thought it would be giving the most variety, and it did. But then I was dissatisfied with it because I thought we're still not getting to the root cause of things.
Hmm.
We're treating symptoms, but we're not treating what causes symptoms. And I
Hmm.
started to see that, and so when I started understanding psychotropism, it was just a whole new frontier for me because I started
Right.
to see like, oh my gosh, there's a different way of approaching this,
Yeah.
but I never thought about psychiatry either because I just thought I don't want to be a psychiatrist. They're weird, and I don't want to be just a cardiologist. I don't want to deal with just
You
one.
don't want to be a nerd, Dr. Paul?
Uh, and so that's why I never wanted to be anything except that
Yeah.
I started discovering, wow, how fascinating it is when you balance people's systems out about what dramatic things we see in their bodies and their minds and everything, and everything changed for me, and that's when I keep writing and writing and writing, and I think my newest book I'm really excited about, is really selling well too, and I'm really excited about this show too, this opportunity with this new show coming up because I really want to educate, and that's
Right.
why I think like bringing someone like you on and having because you do stuff I don't do,
Yeah.
which is fascinating to me because I don't have all the answers, that's for sure. I don't pretend to have all the answers. I like to use other people to help me. I work with an acupuncturist here, and sometimes send him things. I have a chiropractor I work with if needed. I've worked with naturopaths, and so I like that group approach of like we all have our own answers to things.
Hmm.
Nobody has all the answers, but we all have our own things that we do, that's different than other people, and so.
It's interesting you said that because myself being the ND and my daughter is the DO in an ER physician, and my son, he is a mental health counselor for crisis work. And I said, wouldn't it be nice if we all worked together? And they're like, I'm not at that point yet. So I'm trying to encourage them to do it before I go. You know what I mean?
When I was in training, I worked in the you do rotations everywhere, and I worked
Yeah,
in the ER, and then the ER doctor. I remember forgetting me. He's like, well, ER doctor, we're real doctors. We're the real
that's
doctors.
right. Yeah.
We fix things. We fix things. Something comes in, we fix it right away.
Right.
And then so he was really cocky. I remember that he just thought we're better than all other doctors. That we we save lives. We Someone comes in and we turn it. So and I just but what I didn't like about ER was that there was just no follow up. They
Right. That's
most
right.
people didn't die, thankfully, but you'd send them out on their way, and you did never know what happens after that. And so I didn't like that. That's like, okay, I don't want to do this. That's for sure. I don't want to be an ER nurse.
Yeah.
I don't want to be a surgeon because that to me, I had no interest in surgery at all.
Yeah.
Um, you know, I,
I loved open heart surgery. That was my favorite.
oh really?
Yes,
Well,
yes.
I mean, it's fascinating, but I don't want to do that full time, and I just
Yeah.
needed the hot lights, and I was sweating, and I sweat easily, and I just was miserable, and it was just not.
Well, you know what I think also too, Dr. Paul, is that the idea is that you bring it back to being able to help the person in what's going on too, right?
Lisa,
Yeah.
this happened here. Does that mean it's
Yeah, you got like 9 minutes left.
for the half hour?
Oops.
Sorry, we got to start back over. Do we have to edit that
It
out
says 9 minutes, 42 seconds. So just,
for the half hour?
yeah. Well, I don't know if it's a half an hour because I think we're getting more time than that.
What time is it right now?
See, we're already at 30 minutes. So you've got another 9 minutes. Oh, that's only if you want to upgrade.
Oh, I see.
So let's see. Who canceled this here?
We have
Hello.
we have to
Hi,
start back a couple
that's
sentences.
okay.
I don't know, Leslie. So,
I think the half hour's up.
well, it says 9 minutes left.
The report's 3 up to 40 minutes.
Okay. All right. You got 9 minutes.
Okay. Well, in closing, too, I think, Dr. Paul, it's important to note that a lot of people have been abused by the systems. It could be a naturopath, and they could send you out with supplements every single time, more than the visit, you know. It could be the ER doc who never listens to you and sends you home with a Tylenol. It could be a primary care that says, I don't know, here's a list of tests. And it could be a specialist that says, here's a drug or a surgery because they were doing a clinical trial. So I think a lot of times you and I see people who have been abused by the systems, don't you think?
All the time. I mean, I see it all the time. And
Yeah,
a common one I see is primary care doctors. They don't know what to do. And
right.
so they don't know what to do if you have anxiety. And they go, oh, I can give you maybe Lexapro or Zoloft, but I don't know what to do after that. And Lexapro and Zoloft, they're okay. They're not the best for a lot of people. Uh,
Right.
they're maybe better than nothing, but then people get flat and apathetic and sexual side effects. And anyway, they say, I don't want that. And
Yeah.
but then they go, well, we don't know what to do, so you have to go see a psychiatrist. Now, again, I don't mean to disparage psychiatrists. I'm not one. I never trained to be one. I learned it on my own. So I'm a family doctor who does mental health full time for, a long time, over 20 years.
Hmm.
So I'm kind of I'm a zebra. I'm a
Yeah.
very unusual doctor. I'm the only primary care doctor I know who does this full time. I don't know
Right.
anyone that does. I'm sure they're out there somewhere. But I get a lot of that. And I think, unfortunately, a lot of psychiatrists, they're difficult to talk to. They're
Yeah.
cold, they're distant, they're very expensive. A lot of them, charge a lot of money. And that's a turnoff to people, and they can't afford it, so they don't go.
Yeah.
And then again, sometimes, they don't get great care. I think the difference I see with primary care, we focus on the body, but we forget about the brain.
Yeah.
Problem with psychiatrists is you focus on the brain, but you forget about the body.
Right.
When someone goes to a psychiatrist with pain and headaches and neck and back and stomach and this and that, chest pain, and then they go to the ER because they're thinking I have a heart attack. You just have stress. You're fine. Well, yeah, my heart's racing. My this and that. Yeah, yeah. You're not having a heart attack. Go home. You're just having an anxiety attack. So then they go home and then they feel less than because they're like, I've just been, the ER just kind of blew me off
Yep.
home. Now they go to the primary care doctor and they say, well, we don't know what to do. So it's like people get passed around the system,
Yes.
and then they go to psychiatry and if they go, and again, I have some friends who are psychiatrists. I don't mean to say this to disparage psychiatrists. There's some good ones out there. Any specialty, there's good and bad. Okay. But unfortunately, a lot of people get turned off, and then they get lost to treatment. They never go back. And then so this is why I've really dedicated my life and my practice into hopefully stopping that trend
Yeah.
and realize and showing patients that look, it's not brain or body, it's both. You can't separate the mind and body.
Right. That's right.
They're totally integrated, and it's not one or the other. And so I think that's why I'm excited, because I'm also I've written two books. I think I told you about them.
Hmm.
After I wrote my first three books, I wrote two smaller books for doctors. I want to train and teach primary care doctors, physicians assistants, nurse practitioners. So my new book, the Corona Protocol, it's going to be called the Corona Protocol Prescribers Course. So I really want to teach. That's the next thing I want to do in my life, and is to teach. So I want to teach other providers how to help their patients, and this is
Hmm.
really help people at a wider, at a much bigger level, is to do that. And so my new exciting venture I want to do. So,
Yeah.
but yeah, so I'm excited. But but that's I think in you're right. I think we need to all kind of come together. And like I said, that's why I wanted to have you on because I'm fascinated by what you do, and I think it's great what you do, and the fact that you do stuff I don't do, and
Yeah, for sure.
we kind of all work together.
Yeah. I really have always thought that that was the way it should be, but getting people to the table, there's a whole lot of egos, and that's, I think maybe we'll see it in our next lifetime. I'm not sure in this one, right?
Anything else you'd like to? Can you give our audience how do they get hold of you? How can they get here with you?
My website is drjeanettegallagher.com. I also have a radio show, Wellness Radio with Dr. J, which I've been doing for 14 years now. And it's all about being able to say, what do I need, or I just need to talk. And that's where we truly start. I always say to myself, I share with the patients, I say, I'm the most non-compliant person there is. You give me a drug or a supplement, I'm going to take it for 2 days and then I'm going to forget about it because I want to see what it does or doesn't do. And it's not something that's going to be a crutch for me. So I think the idea is that what are we going to see and how can it help us change our life, our quality of life?
Right. Excellent.
Yes.
Well, I'm so appreciative that you came on my show. I think the audience is going to really learn from this, and I appreciate you and what you do.
Oh, I'm so glad to be on here. Just as I shared on the end of my show, happy to come and dance in the ethers, right?
Thank you so much. You have a great rest of the weekend.
Thank you. You as well. Have a great day.
Bye.
Bye.
You have to repeat after now. Sorry, we didn't have to do an hour. That's good. It's like that'll be like 40 minutes. It'll be a little longer than half an hour. That's good.